This week is hip pain week, specifically hip impingement. Now, a lot of you guys think you have hip flexor pain, and it is not. Hip impingement cap is right here. Here's a quick test to see if that's what's happening with you. Watch, pull your leg up just like this, pull your knee inward. Do you get a pinch or an ouchie? Then that's what's happening with you. And guess what that means? That means your mechanics are fucked up. It's taking you thousands and hundreds of thousands of reps to get like that. And it's gonna take that many to undo it. So let's get started right now. Now, here's the problem. Every single time with hip impingement, you are an anterior tilt like this, and when you squat, you bend down, and you keep an arch, and you round, and you butt wig, and face view on, your knees collapsing in, and what is happening is this thing spinning in and up, and that's what happens. This week, you're gonna learn how to mobilize the groin, you're gonna learn how to strengthen your hip in the right position, and you are gonna start improving today. You must first learn the importance of your pelvic angle when you squat. This learning exercise is a great teacher, especially if you feel hip impingement. Start standing in your normal squat stance, like you would normally squat. Now, what you're gonna do is a pelvic tilt. Stand, tuck. If you feel hip pain here, that's not good. You're in trouble. Now, next one, go to half of a squat. Now, pelvic tilt. You may feel that impingement starting when you arch right there. Tuck under into a neutral, and if it stops, you are learning. Now, go even deeper, can you? Down to there. Same thing. You may feel that pinch with the arch and tuck. Boom. If this is challenging for you, get up, put your heels up on something that's about an inch high and do it, just like that. Right, you're learning about your pelvic angles and what you must do, the position you must maintain to stay pain-free. This training technique is going to help you find and maintain your pelvic neutral in the squat. See, this, now drop your hands and knees, watch, same thing. See, it's the same thing, but you don't have any weight on the spine, so it's easier. Start like this. Use a stick, put it in front of you. This is face, dick, stick. Now, what you're gonna do is find that neutral position, keep it on those 3 points of contact, and sink your hip back. Watch yourself in a mirror or record yourself. This stuff is importante. Now, work on maintaining that position because usually you're gonna wanna arch or you're gonna wanna tuck or do some weird stuff, okay? That's gonna hurt you. You have to focus on this for thousands of repetitions. Next time, next video, you're gonna learn the criminal. The criminal. The criminal. Driving your knees out wide requires you to have glute strength and also a mobile groin. And when you're able to do this properly, you'll maintain an upright spine position, which will improve your squat and decrease the pain. Got that? Now, for this exercise, this one's crazy. Watch this. Lay down on your stomach. This is killing dos birthdays with one stone. Get a leg behind, just like this. Get that foot behind the knee. Now, this is the easier position with your hand here. Now, work on bringing this knee up like this, maintaining this hip position and keeping the core engaged. You should feel this thing burning in the glute and opening up that groin in the front. More advanced version is this. Hands behind the back. I'll tell you what. For those of you guys that can keep and maintain this position in the pelvis and get this knee off the ground, the first 3 you guys will send you guys a t-shirt. So go ahead and send our videos, send the videos in. More information is in the description. Improve your squat position, which will reduce your hip pain in the front, means that you must learn how to drive up from the bottom of a squat with your glutes. And currently, you are not. You're a quad driver. Yes, you are. Now, here's an exercise technique to learn and practice. Get yourself in a sumo stance, real wide stance, turn your feet out 15 degrees or so, keep those knees super wide as well. Now, have something in front of you, record yourself. You must drive up vertically. Understand? It's going to be hard to do it at first. Most of you, instead, what you're gonna do, this is what you do in your squat, when you bend, when you do everything, when you get out of the car, when you get out of bed, when you get off the toilet. Here's what you do. Have somebody stand in front of you with punching a glove right here, and that's exactly how you're gonna start. You're gonna lean forward, which pinches the pain in the pinches the hip in the front. Okay? You must do this stuff forever. It's gonna take you months and months of practice to improve this. So get started now. Now, getting everything you learned this week, it's time to put some training wheels on your squat. You ready? Here we go. Band around the knees like this, get about an inch heel lift, something that's gonna get you up in the air a little bit more, have a light weight, 5 pounds or so, and you're gonna move at 1/4 the speed that you think you should. Slow. Slower than that. Slower. Now, maintaining all those positions, the pelvic position, the ribs down, shoulder blades down and back, hips this, keep the vertical spine, driving upwards, blah, blah. You're gonna watch all the videos and do this stuff, okay? Super slow. You're training proper movement. Now look, for those of you guys who need more, who've had surgery, considering surgery, this is interfering with the quality of your life, you're not living the life that you know you can live or want to live, enroll in the MoveU program. That's what we designed it for. It will change your life for the better. Click the link in the bio, get on a webinar, learn about it. We love the shit out of you guys and want nothing but the best.